It's the first distinct rise. Fourth wave of COVID-19 is here, says epidemiologist Michael Baker. Oh, him again. Epidemiologist Michael Baker says that the country is experiencing its fourth wave of COVID-19 infection and warns people to stay vigilant while he counts all that grant money. That's my comment. He said it's not as intense as the previous waves, but is definite, with a gradual rise in the number of self-reported cases every day. Gradual rise? As seen in RNZ's ongoing database of COVID-19 information. It's the first distinct rise, a sustained rise in cases this year. We've seen that numbers reached a low point in February and have been tracking up since then. But wait on, wasn't there something that was 95% effective? The average number of daily cases sits at about 2,000 at the moment, but Baker said the actual number could be higher with people less inclined to test and report. Yeah, that's because they're over you, mate. He said other indications, including the number of hospitalizations, people in intensive care units, deaths and traces of the virus in wastewater, are also pointing to a new wave. You can just tell he's getting excited. This is really stimulating him. He encourages people to get the new COVID booster. Isolate if they're infected and mask up in poorly ventilated environments. Mate, it doesn't work. What planet are you on? Seriously, you need help. There's a quote from Michael. It's really important that everyone who has a position in authority thinks about the health of their workforce and their school population and the social venues that they operate in. Baker also said the Ministry of Education should provide monitors to reduce transmission in early childhood centres. He also encourages people to mask up on public transport. Poor deluded man. If you're on a bus, commuting or train, you're going to be in that indoor environment for many hours every week, and the ventilation is poor. So that would be a situation where I think masks should still be worn by everyone. There's only one person wearing a mask, and it's not a physical mask. Last week, Cabinet decided to keep the few remaining COVID-19 restrictions for at least the next 2 months. Most pandemic rules have been scrapped, but people still have to self-isolate for 7 days if they test positive, and masks must be worn in hospitals in some circumstances. What theatre is this? How crazy does this have to get? Everything I've possibly seen says masks don't make any difference. So why are they banging on about it? Why is this genius still talking about it? And saying there's a fourth wave is admitting that the vaccine doesn't work. So why would you recommend taking more?